I have started.
Okay, perfect.
Thank you very much. Thank you, Seife. Thank you, Hiro. Dear colleagues, good greetings from New York, from the UN Statistics Division on this third day of the United Nations Expert Group meeting on assessing the impact of the COVID-19 pandemic on census taking in the world. This is the third day of the meeting, of this expert group meeting, and by way of just shaping the stage for today's presentations and for discussion, allow me just to outline some of the major points that were presented yesterday by our colleagues from national statistical offices. We have listened to Australia's presentation and the way that they coped with the lockdowns that were a necessary set of measures introduced in Australia in terms of mitigating the impact of the COVID-19 pandemic, and that certainly presented a lot of challenges for the census that was taken starting from August this year. We have learned about Chile and the extremely negative impact that the COVID-19 pandemic had on their plans for conducting the census, and the need to now reassess the best approach to conduct the censuses 2022, learning from the experiences from countries that were able to conduct the census despite the pandemic. Then Croatia presented their approach that was based primarily on the combination of CAVI that covered around 40% of the households, followed up by the CAPI with the computer-assisted personal interviewing that is still underway, and we will be learning about the results once the post-enumeration survey is conducted, and then the records from the post-enumeration survey matched to those collected from the census itself. India also had to adjust, and their adjustment is based now on the development of the mobile applications that will be used for both self-enumeration as well as the CAPI approach. And then they will be relying on the user-on-device approach. Italy had also suffered the impact of the COVID-19 in terms of maintaining their permanent population census, since the survey that was planned for 2020 had to be cancelled due to the pandemic, and now the adjustments are being made based on the experiences from the 2019, and then whatever results will be coming in by the end of this year. Portugal adjusted to the census that took place in April this year. And what is really quite impressive is the percentage of households that replied online, almost 90% of all the households. And we have learned how Portugal did develop alternative ways of ensuring that the households and the self-enumeration by internet is conducted, as well as the follow-up by the enumerators themselves. South Africa had also to postpone the census, and now is exploring different approaches and the combination of methods. In some cases, as presented by South Africa, some of the methods are not really applicable to all the population groups that we have in Africa there, and therefore they need to adjust and to test for the census that is planned at this point of time to be conducted in February next year. Zambia, again, the postponement of the census and the need to ensure the personal protection equipment, and these costs were not budgeted previously, so they need to go house to house, canvassing the whole countries, as there is really a very low availability of the internet there, and then of course there is population that is living in remote areas and needs to be contacted directly. So these are some of the main points of the presentations that were extremely, I would say, informative, comprehensive, and provided a sound understanding on the difficulties that the countries were having in conducting the censuses in the midst of the pandemic and trying to maintain the census sequence to the best extent as possible. What we can draw in terms of overall conclusions there is that the resilience of census taking has been challenged very much during 2020 and 2021. However, the countries are really raising to the issue, and they are raising to the challenge, and they are trying to modify, to adjust, and to adapt their census taking operations and procedures in order to bypass the difficulties that the pandemic is putting before them. So in those attempts, we have learned that relying on the methods that prevent tete-a-tete interviewing, using the internet alternatives, using administrative sources, have proven to be successful, and they will provide an additional input into the overall learning exercise from this census, with taking them into account for the next round of censuses as well. What we have also definitely learned from the presentations is that there is a shift in the thinking on how best to address the census taking. However, there are a number of countries that still have to rely on door-to-door canvassing, and for them the use of protection equipment is of paramount importance. However, these were not budgeted initially for the census, and that represents additional difficulties that needs to be overcome. We are going to turn our attention today on two sessions. The session 5, which is the assessments of the process quality and output quality for censuses conducted during the COVID-19 pandemic, and session number 6, the effects of the COVID-19 pandemic on data analysis and comparability over time. What we are hoping to focus on during session 5 is the fact that the quality of census processes have been again challenged because of the need to institute clear measures to mitigate the impact of the pandemic and to mitigate contracting the COVID-19 virus. So how those measures impacted the quality of the census results? What were the use of paradata in that context? The paradata are those that are generated by electronic devices themselves, and can essentially be of very important use in terms of monitoring the enumeration process. We can also discuss some of the indicators for quality assessment, such as the response rates for each mode of data collection, if a combination of mode have been used, and then perhaps the number of attempts that the enumerator had to undertake in order to reaching the respondents. So we will be having the presentation from Australia, Canada, China, Hong Kong, SAR, Slovakia, United Kingdom, and United States in this part of the today's work. And then session 6 will be the effects on the COVID-19 pandemic on data analysis and comparability over time. This here, again, we know that we are using the inter-census comparisons for the sake of assessing the quality of the most recent census. This may be affected by the fact that we did have issues with really reflecting on the impact of the pandemic on international and internal migration, on the labor force, and education activities. So the comparability may need to be further elaborated and analyzed. Furthermore, what we are also focusing upon here is that we need to provide a detailed explanation to our users, to usership, about the quality of the data and the possible the possible anomalies that may have been put into the census results due to these adjustments on the COVID-19. And here we will have three presentations from, again, our colleagues from Canada, Latvia, and Tajikistan. So what I would suggest is that we adopt the same pace as we did yesterday, that we have three presentations and then open the floor for discussion, and then until we exhaust the 2 days program. So with this, I will then open the floor for any comments or suggestions you might have at this point of time, whether it is on the program for today or overall comments or suggestions, whatever you feel you would like to raise at this point of time. So the floor is open. Please raise your hand. Very well, thank you. We will then proceed with the presentations for Australia, Canada, and China, Hong Kong, SAR, in this order. Australia, would you please take the floor and share your screen?
Hello, I'll just share my screen. Is that coming through?
It is. It is quite nicely. Please go ahead.
Great. All right, well, thank you and hello, everyone. My name is Peter Darby and I'm part of the demography team at the Australian Bureau of Statistics. Before I begin, I would like to acknowledge the traditional owners of the land that I am meeting from today, the Ngunnawal people, who are the Indigenous people in this part of Australia, and pay my respect to their elders past, present, and emerging. Today, I'm going to provide an overview of the quality assurance activities that we have in place across the census program in Australia. Australia's census night was on the 10th of August 2021, and this was not changed or moved due to COVID. Enumeration is mostly completed, and we are now very busy with data processing. We are very pleased with how our census has gone so far, and as my colleague Georgia Chapman mentioned in her presentation yesterday, we're expecting to exceed our target response rate of 95%. Given we are still in the midst of our census, some of the quality assurance activities that I will talk about today have already happened, for example, that in data collection, but some are planned and may change as we progress through processing. So this is an overview of my presentation today. I will briefly cover our key quality assurance activities across the census program, including in data collection, processing, our post-enumeration survey, and our independent assurance panel. Firstly, I think it is useful to consider all the ways in which COVID may impact data quality, as well as the perception of data quality. With respect to data collection, as we heard on Tuesday, there may be impacts on how respondents interpret and answer questions. For example, what is your business location if you're working from home? As we heard about yesterday, there may also be impacts on field operations, which has the potential to affect response rates and coverage. And these impacts in the field are more likely to affect some population groups than others, which also has the potential to lead to quality issues if not managed. In terms of impacts on the data itself, as well as in data processing, the pandemic brings about real-world changes in the data, and while we will expect to see these changes, this can make quality assurance more challenging. We have to use a broader set of tools than time series and comparison data sets to assess the quality of the data. These real-world changes may also affect interpretation of the data and perceptions of quality. A census conducted during a pandemic will capture a snapshot of the country at a unique time, which may change the longevity of the census data and the way that it is used. This doesn't necessarily impact on data quality, but can affect how data users perceive the quality of the data. From an operational perspective, there are also changes to how our processing workforce operates, which also has the potential to affect data quality if not managed. These areas here are just a subset of the potential impacts of the pandemic on data quality, but hopefully give some sense of the breadth of issues that we need to consider. In the data collection or enumeration phase of the census, our focus with respect to quality is mostly on response rates and coverage. To manage this, we used a range of data sources to monitor our operations and their potential implications for data quality. We have an operational insights tool that provides us with near real-time field data, which produces predefined reports at different levels. There are strategic level reports for executive staff, and my colleague Georgia showed a snapshot of one of those in her presentation yesterday, down to operational level reports for staff in the field or for people managing staff in the field. We designed these reports well ahead of time based on what information we thought we would need to be seeing at these different levels. We used information from our digital service, including our online forms, the contact centre, and from the field, such as information provided by field officers in their mobile apps and reporting back. This information and the reports allow us to monitor progress, particularly with respect to response and coverage, and then to make informed decisions about how we need to change our approach if necessary. This slide shows a framework that we used throughout enumeration to plan for data quality management in the field. A field data quality review forum met several times a week, and there was a complementary data operations forum that met weekly. These groups would refer to a diary, which was prepared well ahead of time and outlined the different phases of enumeration and what our focus needed to be. The recipe book showed us what we would need to achieve in these phases and what information and reports we might need to inform us, so some of the tools that I was talking about earlier. We prepared detailed forecasts and targets based on previous censuses, survey results, and assumptions about COVID impacts and restrictions to help guide our analysis and how we interpreted the real-time data coming in from the field. And we also had predefined key decision points at which we needed to make decisions by. For example, when we needed to potentially redirect staff from particular areas or send out approach letters and things like that. This very planned approach was enabled by the real-time data that we had available in the field and allowed us to monitor our response and coverage throughout enumeration. Now, there was some discussion on homelessness enumeration in Georgia's presentation yesterday, so I won't go into too much detail on this. However, there were cases in the field where the data and data quality for particular population groups had the potential to be more affected by COVID than others. This has meant that we've had to be very flexible and responsive in finding solutions to address potential data quality impacts. For the homeless population, and particularly for rough sleepers, in addition to adapting field operations where we could, we have used a range of de-identified data sets provided by partner organisations to support enumeration planning, to validate the data, and in some cases for data substitution. So there are some examples of the types of data used on the slide. Additional assurance is also provided through our expert advisory group, the Homelessness Statistics Reference Group, and we are aiming to maintain the quality of the data throughout this process. However, it will be important that we communicate any changes to data users to maintain their confidence in the quality of the data. Once we have collected the data, our attention turns to data processing, and this is the phase that we are in at the moment of the census. During processing, response rates and coverage are still high priorities, but our ability to change these is smaller than during enumeration. Our objectives of quality assurance in data processing is to ensure that the coverage is accurate. So, for example, making sure that all out-of-scope dwellings are accurately reflected, and this will impact our response rates and our dwelling and person counts. We aim to ensure that any systemic errors and anomalies are detected and resolved, particularly any that are introduced through the processing systems. And we also aim to ensure that the results are accurate, relevant, and coherent, are explainable and reflect the real world, which is easier said than done. There are a range of approaches that we take to quality assure the data in data processing, and some of these are listed on the slide. I think the key point here is that the pandemic has changed how we interpret differences between the census results we are processing and comparison data sets and time series. It also affects how easy it is to determine if the data is explainable and if it's reflecting the real world. This means we've had to do a lot of preparation to understand what our expectations are for the data and any expected changes in trends and patterns and things like that. To inform this, we undertook an exercise ahead of time to summarize what our expectations for key data changes would be. Even with this, however, there is more emphasis on staff really understanding the data that they are working with and ensuring that they have all the information available. And that's something we've had to really focus on in terms of upskilling staff, and particularly for those who may be new to Census. In addition to this, we have plans to compare the census results to external data sets and administrative data. While we have done this in previous years, we're planning to do this on a much larger scale in 2021. A key part of how we assess the quality of the census is through the post-enumeration survey. The post-enumeration survey is a coverage survey run shortly after the census. Our survey is approximately 0.5% of households in Australia, around 50,000 households. Unfortunately, but as to be expected, the post-enumeration survey has faced similar challenges as the census due to COVID, and particularly in the field. We are currently in the enumeration phase of our post-enumeration survey. Enumeration's finishing in about 3 weeks. Similar to our strong census results, we are very pleased with our post-enumeration survey results so far, and we think we're on track to meet our target response rates. And this is particularly great given that enumeration has been in such an uncertain time, with much of our country in lockdown and restrictions on the access that our field officers have. A strength of our approach in the post-enumeration survey has been our telephone-first approach. This approach involves us sending a letter to potential respondents, which asks them to call us for a short interview, and you can see an example of the approach letter on the slide. We worked closely with behavioural economics specialists on designing this letter to prompt the best response. This telephone-first approach was introduced in 2021, and we had planned to do this even prior to COVID. This has worked out very fortunately, as the pandemic has meant that we've had much more reliance on a telephone-first approach than we would have expected otherwise. And we've got a really strong telephone response so far. In terms of quality, the post-enumeration survey information is collected via interview. So this is generally expected to be higher quality information than self-reported information on the census. As a result, the post-enumeration survey results are typically considered as a source of truth when compared to the census results, and it is through that lens that we use it to assess the quality of the census. The post-enumeration survey provides measures of coverage of the census, including undercount and overcount. The headline figure from the post-enumeration survey is typically the net undercount, which is the difference between undercount and overcount. In 2021, however, we will be producing more detail and placing more emphasis on gross measures or total measures of undercount and overcount to better describe the census coverage, noting that using the net figures can sometimes disguise quality outcomes and what's going on underneath the surface. In addition to coverage, the post-enumeration survey also provides measures of misclassification, so where for individual census responses differ from post-enumeration survey responses. And in 2021, we are also exploring the potential to further understand non-response bias through the use of administrative data and linking that. The final key part of our quality assurance is the independent assurance panel. The panel plays a key role in providing confidence to our data users that the data is fit for purpose, as well as managing expectations and perceptions of the data quality. The panel was first established following the 2016 census, so this will be the second time we're doing it. And the 2016 panel published a report on their findings on the same day as census data was released, and there's an image of the cover of the report. The 2021 panel meets for the first time this week, or next week, and similar to last time is expected to deliver a report mid-next year coinciding with the main census data release. The panel has 6 members with a wide range of expertise and representation. Some members this time are the same as the 2016 panel, but we also have some new members. In summary, this slide shows the key data quality measures we use and consider when assessing the census data quality. There are multiple measures from the census and post-enumeration survey, as well as external assurance by the Independent Assurance Panel. Ultimately, however, once the data is released, we will also receive feedback from data users, which will give us insight on the quality of the data and how it's being received. And that is the end of my presentation. Thank you.
Thank you very much, Ms. Darby. May I use my position as a chair to please ask you to return to slide number 10?
This one?
And yes, thank you very much. And then if you would be so kind to elaborate on the last point that you have here, exploring potential non-response bias through use of administrative data.
Yes, so this is something, yeah, we're still exploring whether this is going to be possible or not, but what we're looking at doing, so we have a administrative data spine, which is called MADIP, which is the Multi-Agency Data Integration Project. So this involves, it's an integrated spine of like tax data, Medicare data, there's some others, immigration data, things like that, social services data. So we're looking at linking that to the PES, if to the post-enumeration survey, if possible, to understand who is responding and then who is not responding, and we may be able to link that to census as well. We're still seeing if that's possible. If we can't link, we will do it in aggregate form. We are aware that due to COVID, there may be some impacts on response in both the census and the post-enumeration survey that may be similar in both. And so we're, I guess, looking at other data sources to see if, well, they may have been impacted as well, but we might as well look at 3 sources rather than 2, and just to see if we can understand if we're missing anyone in particular.
Thank you very much.
Help clarify? Great.
Absolutely. Thank you. Thank you very much. Thank you, Ms. Darby. And thank you, Australia. We will, of course, have the opportunity to post comments and questions to all the presenters once we hear from Canada and China, Hong Kong. So let us move now to Canada. Would you please take the floor and share the screen?
Good morning. Yes, I will share my screen. Should be. So you can please confirm that.
Yes, we can see. We can see the slides, and it is
Perfect.
now in slide mode. So please go ahead.
Perfect. Okay, so good morning, everybody. So I would like first to thank the UNSD for organizing such an interesting meeting and for giving us the opportunity to learn from the rich experience of so many countries and to share our own experience. So I'm Patrice Mathieu. I'm Director of Census Operation Division at Statistics Canada. So I will do the presentation this morning. Since we didn't have a chance yet to talk to you a little bit about our census, I'll take just 2 or 3 minutes to give you some background information. So the census in Canada is conducted every 5 years, and our most recent census was conducted in last summer in 2021. From May to mid-August, Census Day was May 11th. It was actually extended to September for certain areas in the country. Our primary objective is to count every person in Canada and every dwelling as well. We enumerate people based on where they usually live. We are de facto de jure census, pardon me, and we are in Canada, in 2016, we enumerated 35 million individuals. The majority of the population is concentrated in urban areas, mostly in the south. Canada can be a very cold country. It's actually -3 degrees Celsius on my phone right now. So yes, it can be cold. And the majority of the territory is rural and remote areas. So just you have probably seen a map of Canada before, but here's Canada. So the green parts on the map are the most urban areas where the majority of the population lives. It corresponds to 86% of the dwellings in the country. So Canada is so big that it's not a one-size-fits-all country. We need multiple collection strategies depending on where we are in the country. So in the most most urban areas, we actually can use our mail service in Canada, Canada Post, to mail the census material, mostly invitation letters or reminder letters. So that works for vast majority of the dwellings, but of course in more rural or remote areas, we need to send census enumerators, not just for the non-response follow-up, but also to deliver the census material or even do some listing if we don't have a good addresses, if we don't have addresses on our frame. So the brown and tan regions are where we cannot mail the census material, not necessarily because it is impossible to mail in general in these areas, but our frame is not of good quality, or the addresses we have on the addresses we have on the frame are not don't correspond to specific dwelling. They are like what we call post office addresses, so people don't necessarily receive their mail at their dwelling. They have to go to the post office or things like that. So that doesn't work well for the census. So anyways, that's the reason why we need to deliver the material ourselves. So, as I said, our census was in May. We had a big push in May for self-response. Several reminders were sent. This is what we call our WAVE methodology. We introduced that in 2011, and it's working well. We're reusing it every census since then. It encourages electronic questionnaire completion. So by default we send invitation letters, not paper questionnaires. It is, however, possible for the respondents to call an automated line to request a paper questionnaire, but we don't offer questionnaires as a first contact. And we have our Census line for questions. We can also complete questionnaires with the respondents on the phone, but especially at the beginning of the operations, we try to minimize that given the volume, the call volumes. And so that's in May, and then in June and between June and August, we have our non-response follow-up activity in the field. And we have our dwelling classification survey that is conducted during the same time frame as non-response follow-up, but it's after, once we're done in a certain area non-response follow-up, we switch to the dwelling classification survey. It's a kind of a post-enumeration survey. It's not our main post-enumeration survey. We have other, what we call our coverage studies that are conducted later after the census. But during census operations, we have an activity called the dwelling classification survey, where we actually go back to non-responding dwellings to try to determine, in particular, the occupancy status of these dwellings and how many people were missed in these dwellings if these dwellings were occupied, and that is used in our imputation strategy. So that's pretty much what I wanted to say on our collection methodology, but of course we had to adapt the plan due to the pandemic. The first thing we did, and I think it was the most important thing we did, is quickly, so shortly after the start of the pandemic, we determined that we needed a new plan, and not just a contingency plan in case COVID was still there 1 year later. So our new plan became our plan A, and we had no plan B. So that, I think that was a key decision that we made. So we didn't duplicate anything, so we just moved ahead with our new plan. So mainly we put more resources on telephone attempts on our call centers, and making sure that we have as many phone numbers as we could, so we could reach non-respondents by phone. When face-to-face visits were required, we provided PPE to field staff, and we practice physical distancing. We typically enter dwellings to complete interviews. That's how we do our non-response follow-up. Interviewers do complete questionnaires with the respondents, not only at the door, but sometimes inside the dwellings. But for given COVID, they were staying outside the dwelling. And we modified a little bit our approach. So during at the beginning of the non-response follow-up operation, we asked our enumerators to encourage self-response. So not only not necessarily try to complete a questionnaire with the respondents, but to remind them of the self-response options. We also added a final reminder letter towards the end of the non-response follow-up period to encourage self-response. It actually worked pretty well. So that was another way to generate more self-response. So we quickly determined that if our field operations are impacted because of COVID, because it's more difficult to make contact with Canadians in person, we needed to put more energy and improve our self-response strategy. And we had new strategies for collective dwellings and remote areas. Collective dwellings, it's hospitals, nursing homes, senior homes, prisons. We would normally send people, field enumerators, in person to these dwellings where they are more vulnerable population. So it was not a good idea in COVID context. So we had to develop in a short period a self-response and a phone operation, which was completely new for us. So that was a big challenge given the short time frame. And in remote areas, it's in particular, it's in our indigenous communities, especially in the north. You saw the map, so it can be pretty remote. We always try to recruit local staff there, but it's often very difficult, and we would often send travel teams from the south to these areas to do the enumeration and travel from one community to the next. But given travel restrictions and the risk of spreading the disease, we put even more emphasis to recruit local staff, and it worked in many areas. So it was a great opportunity actually for us to improve on that, and that's something we want to keep actually for the future censuses. And we also developed a contingency strategy that could be used at the imputation stage if required. So we developed an administrative database. So the idea is to use administrative data to improve our imputation strategy in case we see a higher non-response than expected. So in the next slide, I want to talk about the risks impacting quality, and I want to show how we are assessing and mitigating these risks. So from collection to dissemination. So if we start with data collection, it's a bit similar to what Australia was saying. We can distinguish two categories of risks impacting response rates, household response rates, or item response, so at the question level, and also coverage. There could be risk on census coverage. So what we did to make sure that we would keep the good response rate and we would reach the targets in terms of response rates. So I've already mentioned our wave methodology, the push for EQ. So we focused on self-response. That was already the plan, but we added that additional wave to generate self-response at the end of an RFU. We made electronic questionnaires available in areas where we were not supposed to, like in particular in these more remote areas. We tend to just go there and do 100% in-person enumeration. But again, given COVID, we decided that we needed to give the opportunity, everybody the opportunity to complete electronic questionnaires by themselves. We changed our communication strategy as well, just to again to put emphasis on the safest way to complete the census is if you do it yourself electronically. So that's and that actually worked pretty well. In terms of coverage, so we improved our. It was already the plan. It's something we did before COVID, but we improved our coverage questions in the electronic questionnaire. So to help the respondents to determine who should be included where, and it was particularly important in COVID context because people were not necessarily staying at their usual place of residence because they were working from home, so things like that. So that could have an impact there. And we have all these others, the other operations on the screen, our failed exit follow-up operation, dwelling occupancy verification operation, our response management strategy. So all that was to make sure that we put a lot of emphasis on determining if the dwellings were occupied, unoccupied, and all these concerns that impact coverage. So if I can just move. Just a bit of on our response management strategy. So this is something that it's our way of managing response rates and making sure that we don't put all the efforts in areas where it's going well or it's going too well, but we left behind other areas. So it's a strategy to make sure that at very small geographic level, we reach the targets, and in terms of response rates and also in terms of quality. So we have reports that and we have a team looking at that every day during the operation, where we look at very small level of geography, the response rates and the occupied rate, the absent rate, all the rates that you see on the screen. And when all these thresholds or these targets are met, then we stop collection in this specific small area, and we can move the resources elsewhere to make sure that we reach the targets everywhere. So this is just of course, during the operations, we had the rates again, as I said, at very small level of geography. But just to give you some highlights, this is our rates for the 2021 census. The column on the right is the actual rate. So we finished with a national response rate of 98%. Our long form rate was 97.4%, 84.1%. Of all the dwellings in Canada, not only the responding dwellings, but all the dwellings responded by internet. Only 4.1 with paper questionnaires. It's respondents who requested the paper questionnaire. Our self-response rate is 88.1%. So as I mentioned, we also put in place an administrative data strategy. So despite a very satisfactory response rate at the national level or even at provincial or territorial levels, in reaction to the pandemic, we improved our imputation strategy. Traditionally, we have been imputing non-responding dwellings with dollar imputation, but for the first time, we have improved our administrative database so that we could use administrative data to improve our imputation strategy. So it will be done at what we call the collection unit level. It's a very small level. It's in areas where we reached lower than expected response rates. So there's not a lot of these areas, but there are. So we're in particular where the response rates are below 90%. So we will use the administrative data we have, but it's limited what we have. It's only names, number of residents, date of birth, sex. So we'll use that to basically find better donors during the imputation strategy. So quickly, just a word on now that collection is over, we have started processing the data and are getting ready for our first dissemination on February 9 in 98 days. Yes, we're counting, and every day is important. So we are assessing. assessing data quality at this stage is complex. So I thought I would just show you this diagram on the left. You have the governance structure of our census. At the bottom, you have the Data Quality Review Board. So it's a group chaired by myself that develop quality management plans and make sure that it's applied throughout the cycle. So we identify risks of potential data quality issues, and we make recommendations to the census project team, in particular, given COVID and given all the changes we made in a very short period of time. All the changes that were made were presented at that committee just to evaluate the changes from a quality perspective, just to make sure that everything was considered and that we could react if something was impacting quality. We could mitigate these impacts. And we have a new certification review committee. So it's a group of senior managers. They review, approve certification plans. They oversee the certification activities. And they provide a challenge function and advice for consultation with external experts. So it's a new group, and it's really to ensure that we turned all the rocks and that what we release has been certified. On the right, you have our structure. So just go quickly. Of course, at the corporate level, we have frameworks, guidelines, and all that. But I think the most important is the one at the bottom. It's at the sub-project task level, where actually errors are made or errors can be discovered. So we developed new tools, new certification tools. I will have a few examples in a minute. And we also had a way of registering, keeping track of all the test cases for the system. That's a key. Making sure that our processing systems worked as expected was critical, especially in a COVID context where so many changes were made at the same in a short period of time. We used the test trail software to document and monitor all the test cases, and that was actually that's what saved us, given the number of changes we had to make and test prior to census. So just to show you very quickly, this is an example of our certification tool. So it's graphs, charts, tables that are available to our subject matter experts to just certify and make sure that they look at small level of geography, at each variable one by one. So I won't go through all of these graphs, but just to show you that it's not something that it's not a dissemination tool. It's not public. It's our internal tools just to make sure that the data we publish has been verified. And just to finish, we are this time for the 2021 census, we have introduced new indicators that will be available to users when we release the data. We had quality indicators before, but this time we improved our strategy a little bit. So we will show the total non-response rates. We will show question level rates. So the imputation, the item non-response rate and the imputation rates. We have a long form for 1 in 4 dwellings. So we will provide confidence intervals for each estimate, for each long form estimate. So that's something new that we're doing for the 2021 census. And again, in particular, given COVID and the potential impacts on response rate, especially at the very small level, geographic level, it is important to have these quality indicators available at the variable level and at very small geographic levels as well. And that concludes my presentation for this morning. I thank you for your attention and I look forward to the questions later. Thank you.
Merci beaucoup, Monsieur Mathieu, pour cette présentation. Thank you very much for the presentation, Canada, and Mr. Mathieu. It is really, again, a comprehensive overview of the set of quality assurance tools that are put in place to ensure not only the quality of the data collected, but also to provide the metadata to the usership in order to better understand the data themselves, and while using them for different purposes of policy monitoring and assessing the living and housing conditions of the population. So thank you very much, Canada. Let us move now to China Hong Kong SAR. Would you please take the floor and share the screen?
Okay, thank you. And I had a little problem with sharing my screen, so I asked Hiraki to share the screen for me. And a little bit introduction about myself. I am Chris Lang from the Census and Statistics Department in Hong Kong, China, and I'm from the 2021 Population Census Office. And I was responsible for the frame maintenance and sampling of the population census that was just happened in June to August this year. And maybe moving on to the first slide. Yes, so a little background, and in Hong Kong we have been having a census every 10 years since 1961, and we have a bi-census in the middle of the intercensual period. And a little figure about Hong Kong. Right now we have a population of around 7.4 million and a total of about 2.7 million households. So just a little sense about an idea about the scale of the operation here. And next slide, please. Okay, thank you. And the basic design of the 2021 census is a long form and short form design. And in this census, about 90% of the households were subject to a short form questionnaires, which contain some basic demographic questions like age, sex, or ethnicity. And then the remaining 10% were subject to long form questionnaires that had more detailed socioeconomic characteristics. So basically, the combined short form and the long forms would provide a simple enumeration of a total head count, and it serves as the control total for our calibration process, but the detailed characteristics are compiled from the long form. So next slide, please. And a little introduction on the multimodal data collection approach. So we've been using the multimodal data collection approach since 2011. So it is the third time we use this approach in our census. And the approach was, of course, designed before the COVID, but we didn't change a lot as a result of the COVID pandemic. So basically, we have 4 modes of data collection. So number one is online questionnaires. For every household in the territory, we would send them a household letter with an activation key and an account number for them to access the online questionnaire system. And together with the login credentials, we also send them a postal return for short form. So they will receive both a household letter with the online system account and also one paper questionnaire, so for them to mail back in. And so far, the online questionnaires account for about 30% of the returns, and the postal forms account for about 40%. So you can see that the postal returns are still convenient and are still a very popular choice among our households. And then we have telephone interviews. It's not new to our census, but in this census, we developed a CATI computer system for telephone interviews. And apart from conducting interviews, the telephone interview system could also be used for answering inquiries, for booking appointments, or we can also dial out to clarify dubious reported data to our respondents. And the telephone interviews now account for about 10% of our return. And so finally, for households who haven't responded using our self-enumeration modes, then we would send out enumerators to conduct face-to-face interviews. And our enumerators are equipped with mobile tablets with validation rules to improve the data quality. And the face-to-face interviews now account for about 20% of the return. And face-to-face interviews are particularly, or field visits are particularly important for rural areas or for some hard to count populations like subdivided units and industrial buildings, because subdivided units are where some apartments are are divided into maybe rooms where more than one household now lives in the apartment. And so they're quite difficult to count because we don't have an official register for them. And some of them may have to be found doing field visits. So the field visits are still important in this respect. And also one more thing to note is that the collected data from all the modes are uploaded to the central database concurrently, or the different modes will share the same database. So if the respondent fills in some partial data using the online questionnaire, our operators will see it in the telephone interview system, and our enumerators will see it on their tablet. So this ensures that all our operators or enumerators will always have access to the most updated questionnaire data. And this is our multimodal, our schedule. So we have two phases for this multimodal data collection approach. The first phase is a 25 days self-enumeration phase, and where people may respond using online questionnaires or postal returns or telephone interviews. And then for the next 18 days, we will send out enumerators to try to visit the households that haven't still responded. So basically what we covered before. So next slide, please. Yes. And apart from the multimodal data collection modes, especially online questionnaires, telephone interviews, and postal returns that reduce or that could be used as a social distancing tool during this census, we also have other measures to reduce the impact of the COVID pandemic. So one of the approaches to, of course, we have to enhance the response rate. And one thing we do is that our enumerators will now have to deliver appeal letters in their first visit. So remember that we will send out enumerators to households that haven't responded. So on their first visit, our enumerators will deliver appeal letters with the telephone numbers on it, and try for the last time to solicit households' response via telephone interviews. And so if the households don't respond, say within 2 or 3 days, then our enumerators will visit them again to try to make a face-to-face interview this time. And we also have enhanced publicity programs targeted at specific groups, particularly the hard-to-count population, like the elderly or persons of different races. We have helpers who can use different languages to accompany most of our ordinary enumerators who can maybe speak English or Chinese only. And we also have publicity with households living in subdivided units. So we basically had a partnership with some NGOs who could solicit their clients living in subdivided units to participate in the census. And we also have some safety measures for census officers and also for our respondents. For example, all of our enumerators had to pass a mandatory COVID-19 testing before they start working. And we also have very stringent social distancing guidelines for them, and we also provide PPE for them. And next slide, please. And this is our quality assurance framework in this census. So it starts with the training and supervision of the enumerators who access the first line of data collection, of the whole data collection and processing. And so these enumerators were basically mostly post-secondary students. So they had to attend training programs on questionnaire concepts and also census procedures. And during the first few days of their work, so they will have joint visits with their chief enumerators, and in order to provide some supervision and feedback on their work. So underperforming enumerators may be subject to some more supervision, and also the submitted questionnaires by all the enumerators will have to be checked by the chief enumerators before they can really be submitted and further processed. And we also have data validation rules on our online questionnaire, CATI and CAPI systems. So they act as the first line of defense, and the questionnaires could not be submitted if their rules were violated and remain unresolved. And so after passing some basic validation rules on the online OQ, CATI, and CAPI systems, the data will undergo some more comprehensive data validation rules implemented in our data processing systems. So if the rules are violated, then our editors may have to perform micro editing, and if they cannot resolve the problems on their own, then they will refer these cases to our checkers, who will have a follow-up visit or have a telephone recall to the respondents to clarify those dubious data. And apart from those follow-up checks, we also have quality checks. So basically, we will arrange revisit or recall of a random sample of the respondents to verify some key information, such as the occupancy, or sometimes to verify some of the more hard to code data, like industry and occupation, because people were allowed to write a textual answer. So sometimes it could be difficult for the coders to decide which code they should apply, and then we may have to initiate a revisit or recall. And also, quarters reported as vacant or demolished or construction in progress or unoccupied will be revisited. So this basically ensures that the coverage is correct. And also, during the fieldwork period, we will monitor the response rate by geographical area closely, particularly areas where a lot of new buildings were built, because the population change in these districts are expected to be the most volatile, so we have to monitor them more closely. And then we have the post-enumeration survey. This is an independent exercise conducted by our permanent field staff, and basically we will look at the under-coverage and over-coverage, and it serves as an important tool for us to assess the quality of the census. And next slide, please. And then a little bit up on our quality indicators. And because the data processing of this census is still underway, so most of the quality indicators mentioned here are not yet available at this moment, but this is a plan of what we are planning to look at in our evaluation stage. So response rate is, of course, one of the most important indicators of process quality. And apart from our traditional response rate, which counts both completed and partial interviews, it's also important to look at the rate of partially completed cases. So we can look at the profiles of the partially completed cases to see the data quality, how the data quality varies among different population groups. And also the response pattern is also important. In particular, we will look at the response rate by different quarters, especially the hard-to-count population groups, like those living in subdivided units or in industrial buildings. And the response rate of these groups are typically lower because they're hard to find, and because they have typically a smaller household size on average, and they may stay at home for a shorter time, so more difficult to reach. And also, some of them don't have a formal or a mailable address, so it will be more difficult for us to deliver them the online questionnaire accounts, and most of them have to rely on our field visits to reach. So the response rate is maybe affected by these factors. And we also, of course, definitely we will look at the response pattern by different enumeration modes. And we actually studied the data of different modes of the last population by census in 2016. And we studied that people using online questionnaires were typically younger, better educated, and have higher income. And in general, the hard-to-count population were also the ones who were less likely to use online questionnaires. So that means our face-to-face interviews, our field visits could not be completely replaced in the near future. So we still rely on field visits to reach these hard-to-count population. And finally, we also look at the visit pattern, like the number of visit attempts before successful enumeration, and also the time of the census return. So our traditional wisdom says that there are maybe more errors associated with returns collected towards the end of the data collection period, and the data collected towards the end of the data collection period are less complete, and we will look at them in more detail this time. And next slide, please. Oh, can we move to the, yes, this one. And for output quality, we have the traditional editing rates and also the error rates from our quality checks and our post-enumeration survey. And we are also interested in looking at the error rates analyzed by different modes of enumeration. And we have imputation rates. In our census, so the non-responding households will undergo a record imputation, and also missing items will have item imputation, and we will look at the imputation rates of different items, in particularly the items that are more likely that were affected by the COVID pandemic, like where they work, like the number of working hours or the usual accommodation, and we will see if these items have a different imputation rates than the past census or by censuses. And finally, we also look at the admin data to assess the quality of our statistics. We have some administrative data or at a broad level, like we have a database of identity cards that gives us a territory count of the whole population by age, sex groups. And we also have water consumption data in small areas, and also a tenancy data for public rental housing. So using these data, we can also compare between the results of the census and these administrative data to see where the over reporting or underreporting happens across different age sex groups or in different geographical areas. So basically, we would take a look at these quality indicators and see how they compare with our last censuses or by censuses or other household surveys to have a more in-depth assessment of the quality of this census. So this is basically the that's my presentation, and thank you.
Thank you very much, Chris. Thank you very much for the presentation, and thank you, Hong Kong. Indeed, 3 presentations that are giving us a good overview of the quality assurances processes that are to be undertaken for the censuses that are actually conducted this year. So this is indeed as recent as it can be, and again, thank you to all the presentations and the presenters. I will now open the floor for any questions and the follow-ups for any of the presentations. There are some already in the chat box, so allow me to start with those, and then to for the presenters to take note of those. Questions for Chris, for Hong Kong. Are paper questionnaires delivered to all households at the outset, or are they mailed out? Do you have a reliable address register? How do you determine which households will respond by each of the four available modes? Another question for Hong Kong. If the PES is carried out by permanent census staff, how can it be regarded as independent? And then Hong Kong, the third one, since you have applied 4 methods, I think online data collection must be conducted first. How did you join households to online census? Is it open requests? And there was a question for Canada here. Do you impute data for non-responding households? Could you please elaborate on this? I believe these were all. There was one question from Australia to Canada, but then it was answered by the presentation, so I will not repeat it. Therefore, I'm now opening the floor for any other questions. Please raise your hand, and then I will give you the floor. Before going there, I would like to ask the questions myself aimed at both Australia and Canada. Given the fact that you are using administrative records one way or the other, either for imputation in the case of Canada or for tracking the quality of and the non-response bias in the case of Australia, are you considering establishing the permanent statistical population registers that then might be updated from the administrative records and maintained on a permanent basis for the purposes of replacing, perhaps in the future, the door-to-door exercises that are undertaken? We do know that in a number of countries this is this process is underway, especially for countries that have a combination of sources that are using a combination of field operations and use of administrative sources. So are you considering at the level of strategy for the next 5, 6, 7 years establishing a statistical population register that will be maintained by the statistical authorities? So this is the question for Australia and Canada. Any other question, please raise your hand at this point of time. I'm seeing none. So in the interest of time, let's address the questions that we already have. So let's start with Australia first. Please go ahead.
All right, thank you. So I think I just had the one question from yourself, Serjan, about whether or not we have a population register or not. So we don't have a population register, and I don't think we are currently planning to go in that direction, but we do have significant person level and business level administrative data sets that we are maintaining over time. We have a program of work looking at the future of this administrative data and how it relates to the census. But I don't think we are currently looking at so our next census will be in 2026, and I don't think we are planning to move away from a sort of more traditional census model for that one. However, we are looking at different ways we can use administrative data. For example, in the 2021 census, similar to Canada, we introduced a new imputation method that didn't substitute administrative data into the census data responses, but it used administrative data to inform the choice of donor in the method. So I suppose for the 2026 census, we might increase our use of administrative data, but at this stage, we're still looking at the traditional census model. That being said, when pandemics happen and censuses are very expensive to run, this is always going to be looked at by the government. So they'll always be asking us questions.
Thank you. Thank you very much, Peter. Patrice, please.
Yeah. Thank you. Yeah, I mean, a bit similar to Australia. So our population register, we don't call it like that here, but it's still at the research stage. So we have employees working on that. And of course the 2021 census and the increased use of administrative data, or at least as a contingency plan, allowed us to learn from that. So we're learning, we're researching options, but like for Australia, it is not in the plan for the next census in 2026 to make major changes. At this point, it probably would not be feasible, even if we had administrative sources that would allow us to do that. So yes, it is still in the air. It is still a research project, but there's no firm intention of we don't have a firm agenda at this point. Our goal is to improve, to see if we want to go there, can we, and how. So yeah, we evaluate and we do some research, but that's where we are at this point for that. But again, 2021 allowed us to make we had to reshift a little bit our the resources that are were allocated to that research project, because to implement that contingency plan for 2021, it took away some resources on the research projects, but at the same time, it was a learning experience, so it was good. Regarding the other question, yes, we do impute non-responding households. So just to make a long process short, our dwelling classification survey is the main source of our imputation strategy. So we go back, as I said, to non-responding dwellings, and we determine with that dwelling classification survey how many dwellings should have been responding and how many dwellings are unoccupied or actually don't even exist. So and by doing and for the dwellings that should have been occupied, we determine how many people were missed. So in this dwelling, there were 2 adults, 2 kids, for example. So and then using these estimates from the dwelling classification survey, we determine how many dwellings, how many households we missed during the census, and that's the number of households we impute, including the household composition. And we use donor imputation for that. So we would look, if we determine that we're missing a certain number of dwellings of size 4, we would take donors of dwellings of size 4, of households of size 4. And new to in 2021, we improved our donor imputation by using administrative data. So if we know from administrative sources that in this specific dwelling, there are 4 people based on, and we know that it's good quality, good administrative data, it's reliable, we can use it. It would help to, instead of just relying on our donor imputation that would, on average, impute the right number of people, we would use the specific household composition. But again, with our administrative information, it's quite limited what we have. It's only the number of people, age, sex. So to impute the other variables, especially the long form variables, we would still use donor imputation, but we would find better donors because they would correspond precisely to the household composition that we obtained from administrative sources. I think that answers the question.
Thank you, Chris. Thank you for the answer. Chris, please go ahead.
Yes, about the question on reliable address register, yes, we have a reliable address register, and that is updated continuously. As long as buildings are constructed or demolished, we will send our field teams to update them. And we also had a census canvassing exercise to the rural areas before the population census. So the address register is pretty reliable, except that, of course, there are hard to count population. For example, we don't have a complete register of subdivided units. We have been trying to do that. So our field officers have been trying to visit apartments in old buildings to try to identify subdivided units, but it's no guarantee that the registry is a complete one. And we also have people living in industrial buildings. We also try to identify them before the census, but of course, there's no guarantee that all of them could be found, because living in industrial buildings sometimes could be illegal and maybe they're more difficult to be found. But in general, the address register is reliable. It's comprehensive. And about our different modes of enumeration, they are open to all households. So we don't dictate which households will respond by which of the 4 available modes. They are open to all. And at the beginning of the census, we will mail out our questionnaires, paper questionnaires, and our online questionnaire accounts to all households as far as possible. Except of course, if they don't have a mailable address, then we will deliver those letters to them by hand by our enumerators. But in general, most of the letters were mailed out by post. And then we have how do we join households to the online census? So on the letter, we will give them the link to the online questionnaire system with login credentials, accounts, account net numbers, and activation key, and invite them to log in and do the online questionnaire. So basically, that's how we invite them to join the online census. And the postal returns received would be scanned. We use OCR technology to scan them and digitize them. And once digitized, they will be transformed to the common database with the other four modes of data. So after scanning, so the data will become compatible with the rest of the different modes with OQ, CAPI, and CAPI. So basically, they will appear on our telephone interview system and also appear on numerous tablets. Of course, there will be a time lag of maybe 1 or 2 days because of post-delivery and scanning, but basically all of the data are compatible. And finally, the PES were conducted by our permanent census staff, by a permanent staff of our department, and those staff were a different group of officers, so they were not responsible for enumeration in the population census itself, and they had some experience in other household surveys. They were our permanent staff, so they were very familiar with our concepts of household surveys. So we believe that the data collected by them or the enumeration performed by them will be of better quality, and it serves as the gold standard compared with the census data, and it serves as an independent assessment of the coverage quality of the population census. So basically, that's all the questions. Thank you.
Thank you very much, Chris. Yes, you did address all the questions, and thank you all. Thank you, the presenters, and for the comments and suggestions. We will have, of course, opportunities to address any other questions as we proceed. Let us now move to the second cluster of countries and presenters. We will start with Slovakia, followed by the United Kingdom and United States. So Slovakia, would you please take the floor and share the screen?
Okay. Hello, everybody. Can you see our screen?
Yes, perfectly fine. Please go ahead.
Okay. Hello, everybody. My name is Cila Kišová. I am working in the Statistical Office of the Slovak Republic on the Population and Housing Census 2021. So I am here with my colleague. His name is Michaela Regešová. Okay, our topic of the presentation is assessment of the crisis quality and output quality for censuses conducted during the COVID-19 pandemic. So the content of our presentation is first the basic information about the 2021 census in Slovakia. After the integrated census 2021 in Slovakia, impact COVID-19 on time aspect of 2021 census, impact COVID-19 on the infrastructure and methodology of 2021 census, and how the data collection is assessed during COVID-19. So the basic information about the census in the Slovak Republic. So previous censuses in the Slovak Republic were conducted in an exhaustive way. Statistical Office of the Slovak Republic collected the data directly from the residents and foreigners having residence within Slovakia who were obligated at the census day to complete the forms by themselves. So self-counting method, or with the help of the census enumerators. The aim of the census 2021 was maximize usage of data from administrative data sources and registers and add the data obtained from the population by self-counting. The key creation of the new census method was to reduce the administrative burden on the population. The census was fully electronic without paper forms. The main reasons were improving the quality of outputs, effective use of existing administrative data sources, accelerating data processing, able to fill in form anytime and anywhere, and also the environment friendly. So, the integrated census 2021 in Slovakia. The 2021 population and housing census was a fully electronic. The population and housing census was carried out in 2 stages, housing census and population census. The housing census was conducted from 1st of June 2020 to 12th of February 2021. The population census taken place from 15th of February 2021 to 31st of March 2021. The impact COVID-19 on time aspect of 2021 census. Due to the fact that the pandemic did not subside even in February 2021 and the ban of personal meetings and lockdown still applied in the Slovak Republic, the National Council of the Slovak Republic proceeded to amend Act on the Census of Population, Housing and Dwellings in 2021 and decided that the original census time for the self-counting remained, but the assisted census, which required fieldwork, would be postponed. The pandemic situation in the Slovak Republic got better at the end of April 2021. Therefore, the President of the Statistical Office of the Slovak Republic issued a decision on 21st of April 2021 to start counting to ensure assisted census for 2021 census. The date of assisted census was from 3rd of May 2021 to 13th of June 2021. It means that the digitally excluded population had 6 calendar weeks for the counting. Impact COVID-19 on the infrastructure and methodology of 2021 census. Important changes because of the pandemic situation in the infrastructure were: the beginning of the project was preceded by preparation, which also included education trainings. The trainings were originally planned in the classic full-time form, which had to be reconceived in a short time, and an online form was prepared via e-learning trainings. Hygienic measures to protect the health of contact persons, census assistants, and inhabitants had to be observed during the assisted census. Disinfectant gels, drops on gloves were provided for contact persons and census assistants, and guidance was issued on how to follow the necessary precautions. Other changes in the methodology. To the population was especially explained the question, what is the periodicity of your traveling to work or school? And the follow question, what mode of transport do you use when traveling to work or school? In this case was explained the situation of working from home and distance learning at the decisive moment of the census, because this day was during the pandemic and during the national holiday. The inhabitant should indicate the frequency of commuting and the subsequent mode of transport, which he would use on a working day, school day, if he did not have to work in the home office mode or be educated remotely. How the data collection is assessed during COVID-19. To work very flexibly and look for new opportunities has moved us forward in many areas. In retrospect, but also during the project, we realized that we can use a large part of the infrastructure in the future not only for statistical service, but can also be useful for other projects within the state administration. We have learned to implement a large part of agenda online, and we are used to this form. Census was a breakthrough in the fully electronic form, using administrative data sources, and of course, the fact that the individual processes had to take into account the COVID-19 pandemic. We can say for the whole implementation team that it was a really strong experience for everyone. In conclusion, we can state that the world censuses has certainly marked the COVID-19 pandemic in many ways and certainly complicated it. On the other hand, the use of the information technology has started to be used more efficiently And there has also been a more intensive use of administrative data sources and other data sources than originally expected. This use had a positive impact on data quality. Other effects for the methodology and the census process itself will certainly be reflected in the preparation of the next census. And it was the last slide of our presentation. Thank you for your attention.
Thank you very much. Thank you very much, Slovakia. Thank you for the presentation, Ms. Kishova. And again, we are. This is an illustration, another example of the adjustments that were made due to COVID-19 and the positive impact it had on overall census taking and the experiences that have been learned in the process. Let us now move to the next presentation, which will be from United Kingdom. Would you please take the floor and share your screen?
Thank you very much, Virgin. What I'll do is I'll take myself off camera just so I can save my broadband so I don't, it doesn't all fall over horribly. So I'll just share my screen just a second. Yes. So hopefully you can see the screen now, and I'll get the slides running.
Yes, it's perfect. If you could, yes, please go
Lovely.
ahead.
Thank you.
Go.
So thank you very much for all the interesting presentations so far and the opportunity to represent our progress in assessing the quality of what we've collected in 2021. So briefly, what I'm going to go through is a bit of the UK context and then overview of our collection approach. I'm going to focus a bit more on the strategy for the assessing under and over coverage and for imputing non-response in total, and then a little bit of the impacts of the pandemic on that strategy. So firstly, for the UK context, we do have 3 censuses in the UK, one for England and Wales, one for Northern Ireland and one for Scotland. Northern Ireland and Scotland run theirs separately. The ones for England and Wales and Northern Ireland will run March this year, and Scotland is next year, next March. So our approaches are as harmonised as much as possible to create UK outputs. But what I'm going to discuss now is the design for England and Wales. So our broad census approach is for collection. It's a self-response census, so people get a letter or a paper questionnaire, and alongside lots of media campaigns and reminder letters and field visits, they are asked to respond themselves. So we aimed mostly at online response in 2021, but we had pre-identified some areas that were more likely to want paper, and people could also request paper if they wanted it. For communal establishments, also known as collective dwellings or group quarters, they were also self-response, but there was additional support from dedicated field officers to help the communal establishment managers do that whole process. The whole thing ran from, the census collection ran from the end of February to the end of April, and towards the end the field collected basic proxy information on any remaining non-responding dwellings. Just very, very basic information about the dwellings themselves. Then after that, for about 4 weeks after the end of census collection, we had a post-enumeration survey, which is like plenty of other ones already discussed so far this week. It was a face-to-face doorstep interview by interviewers. And we use that to assess and we correct for under and over coverage. So that comes to processing. I've only got one line for processing here, but obviously we all know processing is a massive exercise. What we get in the end of that, though, is we publish an estimate that's fully imputed for any missing items, any missing people, and any missing households. And we aim to use admin data wherever possible, but it has to be appropriate use of admin data. So in summary, the first 4 lines of that were our census, then our post-enumeration survey, and some admin data go into how we look at coverage estimation and imputation. So that's the broad approach. What I'm going to go through now is not in any detail about how we've assessed the collection or the process quality. So other presentations have covered that really well, and also all the techniques and recommendations explained much better in all the various UN guidance documents. Bit of a plug for them there. The following is more about how we've been trying to be prepared in our own design that we've developed over the past few censuses, and also how we've made much better use of data that we've got now, because we've got so much more data, but it's appropriate use of it. So I'm going to focus on the assessing the collection of the coverage of the collected data. But just to note that during collection, we had some really strong targets in order to achieve what we wanted to do with our strategy. So we set in advance that we needed at least 94% overall return and at least 80% in every NUTS 3 area level. So we've achieved that and a bit more. So we've started with a really good basis for our strategy. What that strategy basically is we've collected the census and we've collected the post-enumeration survey, and we match them together to a really high quality. So, and we have to use lots of clerical matching to help do that as well, because if you miss 1% of matches, you essentially end up overestimating your population by 1%. So these all feed into a dual system estimation model, which is a capture-recapture method to estimate the undercount. And then we spend a long time assessing how well that has worked, because it's really important, as has been mentioned previously, that those two sources are independent. But they won't always be independent, so you have to start looking for any dependent biases. So we've developed these over the last couple of censuses anyway, but we've started to look at other ways of looking at it through different lenses. What we end up then is estimates of non-response by key characteristics, and we can create our sort of frame of our entire database. We do lots of validation of the results against comparator sources, demographic analysis and things like that. And then we end up with a fully imputed database for any items, people and households that are imputed there. So there's a lot more quality assessment involved than just that. I mean, even getting to that first point of having census and post-enumeration survey data, there's lots of diagnostics to check item non-response, resolving duplicates, making sure everything is georeferenced properly. There's lots of work involved in all of that. But just focusing on these aspects here, the things that I'm going to put a couple of boxes now, the text that's in white is things that we've already previously demonstrated, and we've known how to do that, and we've got really robust results from them. In 2021, we started making a greater use of paradata from collection, like local response rates, number of field visits, the paper versus online response. And we've put them into a logistic regression model. Previous dual system estimation approaches have been quite basic, relatively basic, because we did things in geographical batches by the way we received the paper processed data. So now we've got all the data together all in one go. So we're starting this at a whole national level. And so we can use this model much more robustly. Like saying, we can also add in all this other information that can help a local area to understand patterns of non-response. As far as assessing overcoverage done, we've assessed overcoverage before, but now we have the capacity to do that a bit more widely, match the census to itself a bit more. But we've just got to be really, really careful of that, some of the health warnings that as you start trying to match across a wider area, you start to get false positives, and just be very careful what you do in that. We also, in that second bullet point there, we do an alternative estimate the number of households. So resolving a lot of those unresolved cases that the fields have got a lot of information about. So making use of all that information, that paradata again from collection, from the field and from the contact sensor. We have that now for 100% of addresses. Previously, we've had to do it on a very small sample because we had to scan enumerator record books that were all written in hand. So we can do that for 100% of sources now, and we're also bringing in indications for new sources that we didn't have before, like local taxes and utilities data. So we're still assessing how we can use all those. We continue to look for other biases, like within household undercount bias, because the coverage survey is there to help us assess that. But again, looking for any dependent biases, whether we can find them and whether we need to make an adjustment for those. And we also know that the chances of the independence between the two sources does rely on some people not just ducking out of both both types of enumeration. So we do know, for instance, young adult males are just really hard to get engaged with either source. So there's potentially a residual bias adjustment we might have to do there, which we've done in the previous two censuses, but it depends on how this one's works. So we have to assess for that. But the one in orange there, we're also doing an assessment of the whole odds ratio approach using an independent source. And it sounds something very similar to what Peter was talking about before, about the like a third source on your dual system estimation. So that's what we'll be doing at checking the odds ratio using health data there. So just very quickly about the impacts of the pandemic. So what we set up, we've assessed to be pretty robust, and we've been helping ourselves by hitting our collection targets and a little bit more. But although we reckon we've got an excellent census, if you validate against alternative sources that aren't measuring quite the same thing, it won't actually look like an excellent census. So one of the issues we're going to have is the management of the messages of that, I suppose. So we've just got to be really careful about what the census is measuring and where the pandemic is most likely to have changed things and the impacts on that collection as well. And for instance, about students, we had to do a lot of extra effort for students during the collection time because a lot of the students in the UK don't live with their parents. It's quite a small country and people do like to travel to a university is very specific to their studies. And so there's quite a big proportion who would not normally be at their parental home, but they were. And we asked them to respond as if they were at their term time address, if they still had a contract to be there, because it makes a big difference in certain cities, the students' population. So it was really important that we got that right in terms of the definition there. We also had an issue of people working from home but staying at a second home, because why would you stay in the middle of a big city if you couldn't do anything there when you could, live with your parents and them do all your washing, or just live in the beautiful countryside rather than living in a city where you make use of the city. So there's issues there about what we've actually measured and how we take that into account, but also the demographic patterns that we're seeing in the data. So births, deaths and migration have had a big blip in their time series over the last 18 months. So we're doing demographic analysis, but you don't know whether what you're seeing is different because there's a blip in the data or because you haven't collected the data right. So again, it's managing expectations of how we're doing that. And I think as Australia mentioned before, is understanding our data, how it's relevant to us and how we can interpret it. We've also got ongoing work to make that census snapshot relevant to post-pandemic circumstances. Of course, we don't know what those post-pandemic circumstances are yet, so that's why it's an ongoing piece of work. So, but just to note, having all those health warnings about the admin data, our strategy doesn't rely on admin data sources, but is using them as appropriate. So, for instance, the health records that we're using to assess the additional odds ratio approach, we believe that is an appropriate use of them because non-inclusion on that database has been judged to be independent from non-inclusion in the census and the PES. So again, it's using things in an appropriate way. We've also got in progress sort of like an independent assessment of the impact on the pandemic on admin data quality, so taking that into account. And really the whole thing is just reinforcing good practice, that we need to understand our comparator sources in the context of what we're actually measuring. So just summary and key lessons, and I apologise, this slide is slightly different to the one that's on the website. But key lessons really, first of all, we started off with a really robust design and the return rate was better than expected. We already planned to make use of increasing use of paradata from collection and increased availability of certain admin sources. We've tried to be as flexible as possible, and we set up in advance all sorts of contingency plans based on what we think we might meet because we've met in previous censuses, but we were able to adapt and look at new ways of looking at risks now because of the pandemic. So for instance, our approach to students and also these extra assessments we're doing. But also the third lesson is about understanding. First of all, understanding that what you flex in collection impacts how you process and what you can output. understanding how your comparative sources relate to your collected data, and understanding the current population so that there is value in having a census results now in the time of the pandemic, even though it has been affecting it. So thank you for that. Happy to receive any questions either now or to me or to the group email afterwards. So thank you for listening.
Thank you very much. Thank you, Carl and UK. What we are having here again a very comprehensive presentation regarding the quality assessment that has been used in the censuses for England and Wales, as well as the dilemmas and the conundrums that are certainly affecting the understanding, the perfect understanding on the composition of the population, the place of usual residence, and the actual population count that have been so severely affected by the COVID-19. And again, as Australia is also mentioning, to a certain extent Canada as well, and what we are also emphasizing in our concept note, this is really a snapshot, and that snapshot will be an anomaly compared to the time series so far established by the previous censuses. But at the same time, it will really reflect the enormous impact that this pandemic is still having on the life of the population worldwide. So thank you very much, UK. Let us move to United States. Please take the floor and share your screen.
Good morning. I'm Deb Stempowski from the United States. Can you see my screen?
It's coming up, not yet. Now, yes, we can see it.
There we go. Good morning, and I'm happy to be here. As I said, I'm Deb Stempowski. I'm the Director of Operations for the Census in the United States. We did complete our census in 2020, so we are about a year ahead of those panel members who have gone before me and talked about their quality metrics. In order to ensure quality from the 2020 census, we had a multi-pronged approach. We wanted to make sure we could share what we know, when we know it, with our stakeholders. So not only releasing information and metrics on data quality, both earlier than scheduled in a typical census and at a much greater level of detail than a typical census. And what I'm going to talk about today focuses on that and reflects after post-collection processing has been complete. So we do release statistics while we're in data collection and enumeration, but today will reflect after we've gone through post-collection processing. To round out our multi-pronged approach, we also have engaged with external expert groups, including the National Academy of Sciences and the American Statistical Association, to also do assessments of our work. So how did we get where we are today? The Census Bureau released the population totals for the United States back on April 26th. That included the country level, as well as populations for the 50 states in the District of Columbia. We also provide to the states what we call redistricting data. Those are population counts with demographics that enable them to draw congressional and state legislative district boundaries. And we delivered that data first on August 12th in a standard big file format, I will call it. And then we also released lots of user-friendly tools around it on September 16th. That data release was the first look at the population of the United States in small areas and the demographics that tell the story of the country. Different for this time in the 2020 census, we also released quality indicators in conjunction with those data releases. We've always provided this information before during collection, but because of the pandemic concerns that were created around 2020, we thought we needed to continue to do this and do it faster during our data release products. So my presentation will actually focus on these operational quality metrics.
Deborah,
and given the time, we can't go over everything we've done, but I hope it gives you
Deborah, I'm sorry to interrupt you, but we are losing you.
Okay. Can you hear me better now?
Now, yes, now, yes, please go ahead.
Okay, all right, very good. So our April 26th release talked about our address, and that included also by data collection operation. Moving to the second release on May 28th, we released indicators that focused on average household size and more information on housing unit status. And lastly, we had a pair of releases under the guise of Release 3. First, we released some sub-state summary of similar metrics to that Release 1 on April 26th. And then we also released item non-response rates by data collection operation for our nation as well as our state level. As you can see here, these metrics are available for 2020 census data, and we also recomputed them for 2010 census data when we did not already have them available. And I've been saying these are the geographic areas that we've released metrics on to date. My slide is not. Is my slide advancing? Hello?
We are on slide 4.
Okay, you're on slide 4. Oh, there we go. So before I get into numbers, some comparisons from 2010 to 2020, which you all know is very convenient for people to judge quality, but we like to provide some caveats. We know no census is perfect, but we've used well-established and proven methods to get as close as we can. We check our work all along the way and have numerous quality checks built into collecting the data. This time around, we've conducted one of the most comprehensive reviews in recent census history. All that being said, there isn't just one number that can quantify the quality of the census. So I want to talk a little bit about things to consider when making comparisons. The first point is that we expect differences across geographies from one state to another or by subpopulation. The census in each state is somewhat unique, and it's why we have the complex operational design that we do. Moreover, differences could be the result of operational changes with the way we collected data. For instance, in the 2020 census, we added the internet response option, and we also used high-quality administrative records to resolve some non-responding households. So different doesn't necessarily mean better or worse, it just means that it's different. So I'd like to take a look at this table with everyone to give you an idea of how we began telling the story of the quality of the 2020 census back on April 26th. When we developed the operational design for the census, we used as a framework our most desired way to collect the data based on our analysis of the quality of that response mode. So in this hierarchy here, we're going to work from top to bottom of the table. In 2020, self-response rate was 5.3% processing. Go back. Let me reshare my screen. I noticed I got kicked out. Are you on slide 6?
We lost the slides completely, Deborah.
Okay, all right. Let me just go back and reshare. 1 second.
Yes. Okay. Now we are
Okay,
at
very good.
slide number 6.
Yes, thank you. I'll keep going. Sorry for the challenge here. So on self-response here, we talked about that line. If we don't receive self-response, we prefer to actually interview a household member at the door. And so that's our next line here. You can see in the 2020 census, we only had 10.8% of interviews with a household respondent. However, we had also introduced the use of high quality administrative records when they were available for a household as part of our non-response follow-up. So we were able to close 4.6% of cases with the ADREC data. In the 2010, you can see here, we only had the respondent household interview, which was 18.8%. Then moving below the blue line, we would really prefer to talk to a household member, but sometimes we talk to what we call a proxy, a neighbor, a landlord, maybe a building manager. After multiple attempts are unsuccessful, we did not use that option as much, which was preferred in the 2020 census. The difference here, 18.2% versus 19.5% in the 2010 census. And then lastly, the unresolved addresses. You can see here that we had 0.4% in 2010, and that is comparative to the 0.2 for the 2020 census. That bottom line there, where there's no value in the 2010 box, was because we introduced a new unduplication operation after we came out of the field, and that resulted in having some households that were then unresolved. So this is the framework that we used to talk about the quality. These next set of slides are information we put together for the public, where we drill down on each item. So here you can see this is just addresses resolved as self-response overall. So it was the first line in that table. And here we have all the 50 states and their 2010 census value as well. We did not have online in 2010, but we wanted to provide this table. It shows how we did in terms of internet response across the states. Then moving down, this is the household interview table that I talked about, again, with the states and the comparison for stakeholders to use. Providing here in 2020, 4.6% of addresses were resolved by administrative records. Our first time for that use, so there's no comparison to 2010. Here's the information by that proxy interview where we might have had to talk to a neighbor or a building manager with the comparisons. And then the unresolved counts. Again, this ties to that last line in the overarching table that I went over previously. So I want to just quickly highlight some notes on our third release on item non-response. So these numbers today are item non-response rates after we've come out of the field and done that post-collection processing. Overall, these rates for most questions were higher in the 2020 census compared to the 2010 census, mostly still in single-digit percents overall. Including less than 1% for population count. And in the United States, the one number we need to get during the census is that population count. It drives our apportionment delivery that the states need. For most questions, item non-response was lowest for households that self-responded. That's not unexpected. And among the houses that we had to enumerate on the doorstep, usually the item non-response rate was the highest for proxies. It's not surprising a neighbor usually can say if a house is occupied or vacant, but they might not know exactly how many people live there or any information about them. I just wanted to give you a sample here. This would take quite a while to go through all of our item non-response rates, but you can see at the national level, this is comparing households who self-responded. The blue bars here represent 2020, and you can see that the rate was lower for 3 of the 4 items. Of course, in 2010, we did not have an online response option. So all of the self-response was paper, and we know the item non-response is generally higher because we can't trigger respondents to complete information like you can online. And before we finish, I wanted to just let everyone know we have a lot of information that expands in much more detail out on our website. We put together this page and have continually populated it since April to keep users and stakeholders informed. If you are interested, you can look there. And then finally, to close out, just briefly to remind everyone about the various other ways that we're measuring and analyzing quality in addition to these metrics. We've already released reports comparing the census counts to our population estimates and to our demographic analysis program, which provides a measure of coverage using birth, death, and migration records. Alongside the release of our redistricting data, we also prepared a number of in-depth reports on the various characteristics such as race and ethnicity around the population of the United States. We are still conducting our post-enumeration survey. We will have our first release of that information early in the year 22. And then as I said, we conduct in every census a robust set of planned assessments and evaluations, over 50 of them that we take the 2 years following the census to complete, and we will also share those with stakeholders when they are complete. And so that is what I was going to talk about today. Turn it back over to you.
Thank you very much, Deborah. Thank you for the presentation, a very comprehensive overview of the quality assurance instruments that have been put in place to assess the quality of the 2020 census of the US. I will now open the floor for the questions and comments. Before that, let me just address some of the questions that were posted in our chat box. There is a question to UK. Thank you for a very interesting presentations. Do you think that the pandemic has affected the independence of the post-enumeration survey and census at all? For example, through non-response in similar population groups. There was also quite a lively, I would say, exchange regarding the census day in Slovakia. I believe that this has been resolved, but I would still appreciate very much Ms. Kishova to address this issue. There was another set of exchanges regarding the accuracy of the administrative sources that are used to either supplement or substitute the missing the information for the enumeration of the census. I believe that quite a few of exchanges have already taken place. But then if there is something else that we would like to address, I would then advise that you take the floor and then ask your question if the exchange has not been exhaustive. Then there is a question from to all the presenters. Will your NSO consider extending the data collection period when planning the next census to avoid the census operation being disrupted by possible lockdowns? So these are the questions that I can deduct from the chat box. However, I may have missed some. We are monitoring the chat box, of course, and then I will stand corrected by my colleagues that are monitoring it. However, if I miss something, please, now is the time to take the floor and ask the questions to any of the presenters from Slovakia, UK, and US. So the floor is open. Very well. Let us then try to address the questions that are there. Would you start Slovakia first, please?
Yes. I guess we already answered all questions in the chat box, but if there are maybe some other questions, we are ready to answer.
So the date of the census was actually 31st December 2020, right?
Right. Yes.
Very well. Very well. Thank you very much. Then moving to UK. Gal, please.
Yeah, thank you, Peter, for your question. And see, we've answered it in the chat box, but I think just to reiterate to people, that's why we're doing all these extra bias assessments at the moment, and it sounds very similar to what Australia are doing. So I suspect I feel a conversation, particularly between us and Australia, coming up quite soon, if that's all right, Peter. And about the other one from Chris about whether NSOs consider extending the data collection period, we had to extend a little bit this year, but we are constrained by when we do the post-enumeration survey. So we really want to do that as close as possible to census time as possible. So there was quite a lot of debate at the time just how long you could extend versus we need to get a decent coverage survey and we need that to be as relevant to the census day as possible. And also, as we were coming out of lockdowns, we didn't want people to start moving around too much, and that really messes up the post-enumeration, the way that would work as well, about the dual system estimation assumptions working about a closed population. So there is a balance there, definitely.
Thank you very much. Regarding the extension of the enumeration period, I am aware that US had to do that. Deborah, would you care commenting on this, please?
Yes, that's true. We had to extend our data collection operations 3 months. The pandemic started and I'd say worldwide lockdown started the week after we began data collection. So we were extending almost immediately there with those lockdowns. But looking ahead to our 2030 census, we're really constrained by our delivery of the apportionment data, in which this time we were able to deliver late. We've never done that before. So we are looking at how we can condense our back-end processing so we have flexibility to extend the data collection and also still deliver the first data product on time.
Thank you. Thank you very much. Again, if there are additional questions, we can entertain them using the chat box or then even emails. Should you come with some other questions that you would like to be entertained by the presenters. Let us then move to the session number 6, which is on effects of the COVID-19 pandemic on data analysis and comparability over time. We do have 3 presenters here. We will start with Canada, followed by Latvia, and then Tajikistan. So Canada, please take the floor.
Good morning. Thank you very much. I'll just put my slides up on the screen. One moment, please.
Thank you.
Can you just confirm that works for you in terms of on the screen?
It is the cover slide.
Wonderful. Thank you.
Yep. Thank you.
Great. So first of all, thank you, Chair, for inviting Canada to present to the distinguished guests on analysis and comparability over time. My name is Steve Treitz. I'm the director accountable for the Census Subject Matter Secretariat at Stats Canada. This is the group at Statistics Canada that's responsible for coordinating the work of our subject matter experts in developing census content, certain processing tasks, certification, analysis, and dissemination. So our staff works hand in hand with the staff of Statistics Canada's Census Operations Division. Patrice Mathieu, the director of that group, spoke to us earlier this morning. I'll provide a caveat to this presentation. While our census day was May 11th, 2021, I only joined this unit in June of 2021, so I'm still coming up to speed and learning from the experts in our center and across Statistics Canada. I'm happy to present on behalf of our colleagues today. I may seek input from others on certain follow-up questions you may have that are related to more nuanced expert information. So, As with any census, Canada's 2021 census is a foundational data source for understanding society, for enabling disaggregated data analysis on diverse demographic groups and regions, for measuring changes over time. Again, we have a 5-year cycle, responding to ever-evolving data needs of our partners. In order to do this, we undertake extensive engagement with our data users, with provincial and territorial partners, with representatives from civil society, academia, and others, all in an attempt to be responsive as possible to these needs. Again, an important contextual piece here is that our census day was May 11th, 2021. This means that when it comes to discussing the impact of COVID on the analysis and comparability, we're still in the early phases of this process. Our release schedule is set such that the first release on population and dwelling counts is scheduled for February 9th, 2022. This will be followed by a series of initial official releases through until November 30th, 2022. So what I'm presenting today is still in development and still somewhat theoretical at this point. So what are some of the factors that have the potential to affect the analysis and comparability of Census 2021? Well, as Therese mentioned this morning, we had minimal in-person enumeration. This cycle, whenever follow-up activities were required, staff followed public health authority guidance. So that means that enumerators were sent in person only when necessary. All interviews were conducted outdoors, they were physically distanced and wearing personal protective equipment. Collections were also affected by historically bad wildfire seasons in Canada this summer, as well as other social disruptions in remote regions, including in Indigenous communities. That being said, overall, the mitigation efforts that were employed were successful to overcome these risks. The overall global census collection rate was 98%, although this was slightly lower in rural and remote areas. We also see lockdown effects. So we're anticipating to observe the effects of lockdowns in the data. For the most part, lockdowns in Canada and public health measures in response to COVID are led at the provincial territorial level and not the federal level. So given the variation in outbreaks and responses, differential impact on the situation of Canadians responding to the census are likely to lead us to observe regional variation across the data. We're also anticipating to see further government interventions reflected in the data as well. So for instance, with federal borders being closed, immigration dropped substantially during the pandemic, and this will of course affect the comparability of the data from 5 years ago. Similarly, government financial support programs are likely to be observed as having an impact on labor, on income, housing data, etc. And then on top of these, I just want to mention that prior to COVID, we had previously planned changes to some of our content and processes, as any of us would at any stage of developing the subsequent census. So for instance, we've added questions on gender, on military veterans, among others. We've introduced enhanced machine learning to our processing, and we had anticipated an increase in our online response rate, which turned out to be a fact in the end. Now, this next slide, I will just touch on very briefly. My colleague Patrice mentioned it in greater detail earlier, but I do want to highlight that certification is critical in order, especially given all of the factors that were just mentioned. So prior to COVID-19, we'd already introduced numerous improvements to our certification process. And so I'll list a couple of them here. And again, Patrice already spoke to these. So outlier identification and verification, checks to ensure that no systemic error has been introduced, consulting with internal and external experts when necessary. As Patrice mentioned, we also put in place a new steering committee on census certification. Further to that, each census subject matter area is required to include a section on the pandemic in their certification strategy to describe the processes that were implemented and the risks that were used to mitigate. And so, given the timing of our census and the collection, we are now fully into the certification process at this stage. So I'll talk just generally about some of the approaches that we're taking to address the issues that have just been talked about. So as I mentioned, we're currently working on our analytical dissemination strategy. Subject matter areas are undertaking considerable stakeholder engagement work ahead of the releases, both related to the certification process, like I mentioned, but also as it relates to the peer review and consultation processes prior to dissemination of analytical products. So what have we been hearing from these engagements? Well, the main stories that people want to hear have to do with the impact of COVID-19 on Canadians and Canadian society, how Canada is changing, and then what are the challenges and successes faced by certain demographic groups and regions? And like for many of you, this is a general trend, partly in response to the increasing need for greater levels of disaggregated data that so many of our data partners have been advocating for throughout the pandemic. We also are employing a number of other storytelling strategies to provide necessary additional context for analytical releases. So, for instance, as the chair mentioned earlier, these are moments in time that we're looking at, and so we're talking about putting in place pre-releases that may take the form of repackaging previously disseminated analyses, pointing to important trends in order to frame the analysis that we'll be releasing, disseminating new original analyses using other StatCan data sources to provide information on aspects that can't be covered through the census data release. And in other cases, we're planning to use a more informal communication vehicles to do things like release interviews with members of specific subpopulations about why particular data points are important and how they'll be valuable to their communities and so on. Then within each of our articles, we're also specifically looking to address COVID impacts head on. So for instance, we'll be discussing trends affected by COVID. We'll be providing contextual pieces and explanatory boxes. We'll be adding comparisons to our peers in other countries to ground the findings. And we'll also be including more recent data points and other sources in order to contrast findings from the census where appropriate. What I'll do now is I will provide a few illustrative examples of what we are planning to do to ensure the comparability as well as to contextualize the analyses. So I'll speak first about the labor analysis. So the purpose of the labor data the purpose is to understand Canada's changing labor market and how this is affecting individual Canadians and broader society. These findings have to be positioned within a context of continually evolving labor market. So for instance, last month's labor force survey shows that Canada's unemployment rate has now returned to pre-pandemic levels. And of course, this will continue to evolve over the next year prior to our labor data release in November of 2022. So planning to do is to use the census to conduct a greater level of disaggregated analysis into the effects of the pandemic on labor at a specific moment in time, and in particular to look at the impact on diverse population groups and regions. Further to this then, due to the varying reference periods in the census content, we will be looking at slightly different moments in time, if you will. So for instance, there are questions in the census that look at a specific 1 week reference period. So in that case, we'll be capturing labor market conditions in May of 2021, when most of the country was dealing with the third wave of the pandemic. We also have questions that refer to a 12-month reference period. So these will reflect conditions earlier in 2021 or during the worst of the pandemic in 2020. So then, as I mentioned before, part of our plan here will be to provide additional context. So by conducting additional analysis or referring to analyses from alternative Statistics Canada sources like the labor force survey, etc. In terms of income, the income data serve to monitor the economic well-being of individuals, families, and households. They provide information at low levels of geography on subpopulations and particularly vulnerable groups. In 2021, just like in 2016, we've used administrative tax files from 2021 from the Canada Revenue Agency in order to inform data on employment income, benefits from various government programs, and these include COVID emergency response funds. So Within this, what we will be seeking to answer in our analysis are questions like, what's the extent of income losses due to the pandemic? What happened vis-a-vis inequality and poverty? Did income redistribution system work? And what are the differences across specific groups and geographies? In terms of our housing work, the questions within the census provide information on the housing stock in Canada, so the number of rooms and bedrooms and homes, housing costs, etc. And these data are used by governments to measure levels of crowding in dwellings, to develop housing programs, etc. There's also information on the age of the dwellings, the need for repairs, and these are used by municipalities to develop neighborhood improvement programs and other interventions. And as an example, these data have been used recently to inform emergency preparedness responses by our colleagues in different regions dealing with wildfires, floods, and other factors. So within this, what we'll be seeking to answer are questions about the impact of COVID on housing affordability and rental markets. And also, as in many jurisdictions in Canada, housing is a human right. And so we'll be exploring whether there are gaps in housing outcomes for members of designated visible minority groups, Indigenous people, LGBTQ2+, and other groups as well. And further to this is a good example where we will be planning to employ some of our pre-release techniques. We recognize that the data within the census is only a slice of the overarching housing story in Canada. The affordability has been a big issue, but there are a number of other issues as well about homeownership rates, mortgage and debt levels, household expenditures, etc., that fall outside of the census itself that we intend to release prior to our census release as complementary data to help ground those findings. I have two more examples here, and I might just pause to get a drink of water, and then I will continue. So, pardon me. So in terms of immigration, the immigration variables provide information on the number of immigrants and non-permanent residents in Canada, as well as on the year in which immigrants were admitted to Canada. So similar to the income data, immigrant status and year of immigration are obtained from administrative data from the federal government department known as Immigration, Refugees, and Citizenship Canada. Now, I mentioned earlier border closures and restrictions have affected immigration patterns and also population counts. Prior to COVID, Canada was observing record high levels of admissions of new immigrants. Since COVID, of course, this has now been followed by historic lows. So the analyses for these releases will include specific discussions and focus on these changes during this time. But we won't stop there. We'll also focus on things like changes over time related to source countries of immigration, where immigrants are settling in Canada, the experience of immigrants as it relates to labor, education, housing, etc., and of course, the impact of COVID on immigrants living in Canada. And the last illustrative example I wanted to give has to do with the family's household and marital status. Specifically, just to mention once again, like I mentioned at the beginning, that Canada has added a gender variable to the 2021 census. Prior to 2021, we had limited reliable data on transgender and non-binary populations. Given the small size of the populations, the census is a relevant and appropriate vehicle to collect these data at the regional level. Our analysis here will focus on helping to inform the development of inclusive policies, programs at the federal, provincial, territorial levels, municipal as well, of course. And here we'll be looking at the cross-section across the census, looking at impacts related to housing, access to services, labor market activity, immigration, etc. Another point that the chair made this morning was that communication is key. Our guide to the census population and the topic-specific reference guides will address the impacts of COVID-19 on the data. And there will be communications related to COVID-19 pandemic in all release materials, including footnotes and all data tables, releases, etc. And finally, just to conclude, the full impacts of COVID-19 on the analysis and comparability are still unclear. We knew there would be some changes coming. Of course, we expect our collection changes and data certification approaches are mitigating any potential negative effects of COVID-19. And importantly, the census will play a key role in helping us illuminate the impacts of the pandemic on Canadian society. Thank you.
Thank you very much, Steve. Thank you very much, Canada, for this presentation. Again, this is what we are trying to emphasize here and to focus upon, which is putting a context on the analysis and the use of census data that were impacted by the COVID, so that we have a better understanding. And thank you for this comprehensive overview of the instruments that you intend to use for that purpose. Thank you, Canada. We will have the opportunity, of course, to address questions and comments to Steve. Now we are moving to Latvia. Tomis Zukula, would you please take the floor and share your screen?
Good morning, good evening. I will share my screen.
It is perfect. It is perfect. Please go ahead.
Okay, thank you. Thank you for this possibility to share some knowledge we have from Census 2021 in Latvia. I'm Baiba Zukula. I'm Director of Social Statistics Department in Central Statistical Bureau of Latvia, and I have been involved in development Census 2021 methodology already from 2011, I can say. Starting, I will say some words about Census 2021 in Latvia. So census moment in Latvia is 1st January 2021, and we have a register-based census. So the method to produce census population is the same what we use already for about 10 years for annual population statistics. We have published already first results on number of population, migration, household, family, nucleus. We published them this year in May. And next data we will publish this November on housing. Data on employment and level of education will be published next year. Because, as I said, we have register-based census and we need time to collect data. Some words about censuses in Latvia in general. I have to say, as it was mentioned already before, census allow us to get a snapshot of certain moment. And in case of Latvia, all censuses were conducted in quite a challenging time. Its results were quite interesting. First census in Latvia was conducted in 1920. It was so World War I ended in Latvia in December 1919. So only half a year after that, first census was conducted. And as you can understand, a lot of refugees, huge migration flows, etc. Census 2000 was conducted after regaining independence, so it is impossible to compare those results with Census 1989 because 1989 it was we were part of Soviet Union, so command economy, different employment situation, and in 90s huge migration. And huge also death rates, very low birth rates. And Census 2011 was jeopardized by economic crisis. Again, huge migration flows, huge difference in employment situation. So Census 2011, we had discussions at the time on the governmental level, or if we have enough funding for census. So at last we had Census 2011. It was combined census, face-to-face interviewing, CAVI, and register. And so already in 2012, it was decided that we have to, in future, we will have a register-based census. So we started to develop methodology already in 2012. Some words about 2011 census results. In this graph, you can see in lighter columns, it's immigration and emigration, which was estimated before census 2011. And those darker columns, this is emigration, which was estimated after census 2011. So we had to do a recalculation of migration, especially emigration. The difference, so before census, the published number was about 11,000 emigration. After revision, almost 40,000 emigration. We are a small country, so we have only now less than 2 million inhabitants. So this difference was huge for us. And this was due to this high migration was due to economic crisis and very high non-registered emigration of Latvian citizens. So they moved to United Kingdom, Ireland, so this amount was very big. Before census 2021, we already, since 2012, we do estimation of population because of this high level of non-registered immigration. So how we estimate, we use population register and other administrative data sources. We use something like nowadays is called Science of Life in administrative records. So we use this method already since 2012, and the same method is used for census 2021. We already in 2012 we started cooperation with other registers. We have agreements, so we could improve the quality. We could influence the quality of registers. And we also started to work on methodology for variables. So already in 2018, we could produce the first test variables for census. So now we can compare with what changes we have. Those test variables are not published, but we have them, so we can evaluate the changes and quality. And quality evaluation definitely is one of the most important things. We do it both for administrative data and also for test variables, what we produced. So this decision taken in 2012 was very far-sighted because we did not have to postpone census 2021 due to the COVID. We have developed methodology and could have census 2021 on time as we planned. And we do not have problems with registers. They provide us all data because, as I said before, we started this cooperation with registers already in 2012. So they are used to provide us regularly with data, and there are no changes. As I said already, we published the data on population. And as I mentioned, the method used for census 2021 is the same we use for annual population statistics. So the reference day is the same, 1st January. Here you can see map of Latvia, and this is usual resident population changes in counties. So the brown part is where the population increase. Gray part is counties where population decrease. Here in the center is Riga city, capital city. For many years, the population was increasing only around Riga city. So people were moving close to the capital city. Here is the most darkest part. Here is the border with Russia and Belarus. But what we saw from data we published on 1st January 2021, that there are three counties which are not close to the capital city, but in those counties last year, this population change, but so the number of population increased. We evaluated the results and tried to understand. And what we know that from labor force survey, we know that about 22% of our population now is working from home. And it means that population can, so people can move to the places they want to live. It is not necessary to be close to the capital city. And as it was mentioned already before many times, this is a snapshot of a certain moment. So we can see this change in 1st January 2021. And we assume that this will only increase. So we also in future, we will see this movement from capital city to other parts of our country, because we think this new normal will be working more from home, not commuting so much to the offices. Also, in case of those communities, there are big cities close. Here is Valmiera and here is Liepāja. And the reason why people are moving to those counties, one is two counties is near the Baltic Sea, definitely very nice place to live, and the other one is also very picturesque place. And so people now are trying more to move places where it is the atmosphere is more relaxed and they can commute. Because this commuting is not it's not everyday commuting. The other thing how COVID-19 influenced our data is definitely the birth rates. And we see that last year birth rates were the lowest ever registered birth rate. So birth number is decreasing in Latvia already since 1988, but last year this was the lowest ever registered birth number, even after regaining independence, when the birth rates were decreasing and there was a very big economic crisis, birth rates were higher. So definitely at the moment we can see only the first impact of those birth rates. So this population pyramid, the number of children is decreasing, so more pronounced this reduction in number of children than we were expecting, and we assume it will influence also in future. Because we know that the mean age of mother is about 30 years, and for first child, mother's mean age is about 27 years. There are many women who are in this age group, but unfortunately, the birth rates are decreasing rapidly. Some countries have additional analysis on birth rates, and they see that women are postponing these things. But in Latvia, at the moment, we don't see it, but hope it will be better. Concerning migration, we are not a country in which we have a huge immigration. As I mentioned before, we had very huge emigration after and during economic crisis, but for last years we did not have so huge migration flows. So now for 2020 we did not see so this big impact, but probably it is very possible that after COVID-19, when situation will be better in European Union countries, we assume that it is possible that our emigration will increase again. So, but it is a question for future. If we speak about employment and unemployment data, as I said, we will publish them only next year. But at the moment, we can speak only about what to expect. Here you can see two graphs. One is employed, the other is unemployed. And here, blue line is labor force survey, quarterly data. And red dot is census test data. As I said, we have test data already. We calculated test data for end of 2019, so to see how our methodology work. First lockdown was in Latvia from 12th March 2020. And there was not so big influence on labor force survey results and on census test database at the end of 2019. The next lockdown was from 9th November 2020, and probably it will influence employment and unemployment data for census, but we don't think that they, so they will be closer to the fourth quarter 2020 labor force survey data. We assume it will be something like that. As I said, we use registered data. In case of employment, it is mainly state revenue service data. So even there was lockdown, people were employed, so there should not be so huge difference. But we will see it next year. How it will be influenced. But this movement to register-based census allow us also to we will produce data on population also next year, very detailed data. So I assume that this we will see this COVID-19 impact more in next years. How it will influence our everyday life, our how to say new normal, how our new normal will look like. So thank you.
Thank you very much. Thank you, Latvia. And then, of course, we will have the possibility to entertain questions. A very, I would say, illustrative example on the impact of COVID on the density of population in Latvia and the internal migration. And the changes in the births are definitely quite striking, I might say. Thank you very much, Ms. Okula. We will get back to you later on with questions and suggestions. Let us now move to Tajikistan, please. Can you take the floor and share your screen? Tajikistan. Seife, Mariam, can you check if we do have our colleague from Tajikistan on call?
Yeah, the name of the participant is Mr. Rizov, and I don't see him in the list.
We don't see him in the list, but we do have the presentation from Tajikistan, right?
Yes, we do.
Very well. So, dear colleagues, apologies for this. We will then try to contact our colleague, Mr. Rizov, from Tajikistan, and ask him to present the Tajikistan Tajikistan presentation tomorrow morning before we go for the conclusions and recommendations. So at this point of time, I will then open the floor for questions for Canada and Latvia. There were 2 questions for Canada, and they were already replied by Steve, so I will not repeat those questions. So I will open the floor for any question or comments for Canada and Latvia. So the floor is open. I would have a question for Canada, Steve. You mentioned that, of course, the conceptualizing the analysis of the census and putting it into the context of the COVID-19 pandemic is of paramount importance for the users and the policyholders. My question here is, how do you see the time frame for releasing this kind of analysis? We simply the point is that we are still some countries here are still in the middle of the pandemic, and it influences the work and the interpretation of the results and the understanding of what is going on in the country. So let's assume that hopefully, I mean, we are now approaching the wake of the pandemic. Then it would make sense to, of course, release those results as soon as possible. But then, what happens if the pandemic continues to really impact the societies, and would that then be a kind of anomaly, or actually that would be a kind of new normal, so to say? And then this is not really the statistical aberration that we are talking about, but we are talking about something that lasts from now on and may last longer. So did you pay any thought of this kind of scenario?
Yeah, great question. Absolutely. I think our approach to this is to say that we don't know what's coming. What we do know is where we've been. So we know what things looked like 5 years ago. We know what things were looking like up until 18 months ago, and then we know what we are seeing as it relates to the census reference period. And then we in some cases are able to have data that are more updated since then. So you ask a really interesting question, and I don't know that I can answer it properly, except to say that our logic here is that taking an approach whereby we are able to where we're planning to highlight relevant data, other data sources, comparable data from our colleagues, such as those on the call here. The intention there is to be able to be more reactive to changes that will occur over the next 12 months. Like I said, a number of our releases won't be out until the end of November 2022. And so our logic there is to be a bit future-proofed, so that we're not, so that our storylines can evolve and respond to changes that we don't know, because we don't know what's coming between now and then. And so I'm not sure if I'm answering your question exactly, but all that to say, this is precisely what we're trying to mitigate against, and why we're recognizing that things are moving more swiftly and changing more rapidly than we would have seen in the past. This is our tactic for being able to respond to those evolutions as they continue.
Thank you very much. Definitely it is something that is unknown, but something that we might consider addressing at some point, because that may happen one way or the other. I would also like to ask Latvia just one question that I believe is not directly linked to what we are discussing here, but I believe has a kind of a permanent dilemma in the minds of many of our colleagues all over the world. So you are relying on register-based censuses, and you do have the system that has been put in place. You do maintain your statistical population register. You update from the administrative sources. You check it. You run it. Everything is fine and works obviously quite effectively at this point of time. The question is, how do you check the accuracy of your data? as we have seen in the case of the let's say traditional census, where you address each household in the country with a request for information, and then you go to the administrative registers and you check the validity of the information, then how would you foresee in terms of the strategic planning for the Statistics Latvia to check whether the registers are really good? They may be good, that they may not be good. As you mentioned, you have a lot of emigration that is not registered because people go and they don't care to go to the register and unregister themselves and so on and so forth. So what would be the methods short of the census, of course, the traditional census, that would check the accuracy of the statistics that you are producing out of the registers?
Thank you for the question. Yes, this is one of the, I think, the most challenges for register-based country, register-based census countries. What we do every time we produce, for example, as I said, employment and unemployment variables, we compare with labor force survey results and try to understand why we have difference and what is the reason for difference. In case of employment, we do also imputation. We partly rely on registers, but in addition, we do also imputation because we understand that, for example, in agriculture and construction, we have unregistered employment. So we do it. For level of education, for example, we also compared with labor force survey results. And what we noticed that for education system in our country was changing due to this change from Soviet time education system to new education system, and especially people who graduated during Soviet time. And according to new systems, they would have a master degree. But during Soviet time, there was not master degrees. They had only higher education. And they usually don't how to underestimate their level of education. What we see in labor force surveys, quite often they say they have only bachelor, but according to our data from according to our decision of Ministry of Education, they think they should have a master degree. And the same with vocational education. So this education system is so complex that not always people know what level of education they have. So sometimes you can see that in administrative data, even this information is more precise than we can get in survey or in traditional census. The same go for occupation. In our case, we have very detailed classification of occupation. And in our state revenue service data, they have occupation on five-digit level, so it is very detailed. And quite often, for example, in labor force survey, respondents say they are IT specialists, but if you are IT specialist, it is quite challenging to classify in which occupation group you are. So, but from revenue service data, for example, we can see that this person, for example, is I don't know, kind of a web page developer or something like that, and we can classify his occupation very, very precisely. But concerning population number, we also compare with survey data. So we see, according to our estimation, person is not in our country, had left, but for example, he responded in a survey. So we can see what differences we have. But definitely we are thinking about a coverage survey. We can say a coverage survey in future, which would help us to evaluate what difference we have between our estimated number of population and probably real number of population in our country. But this estimation we already do, this statistical population register, it has about 8% difference with population register. It means we already think that about 8% of our population had left our country without their registration. So, but definitely this is quite challenging how to evaluate the quality of data you have from registers and data you could get in field. Thank you.
Thank you very much. Thank you. Thank you. Definitely. So, dear colleagues, thank you very much for yet another extremely useful and informative day of the expert group meeting, or the UN expert group meeting on the impact of COVID-19 on census taking. Let me then try to conclude the meeting by laying out the scene for tomorrow. We do have two countries that for which we do have the presentations on record, China and Tajikistan. We will see if we are able to have them to participate tomorrow. I believe that there are technical issues, most probably with Tajikistan. Of course, the time difference does not play to our advantage, especially with the countries in the Far East. We'll see if we can have those presentations the first thing tomorrow morning. After that, we will turn our attention to the conclusions and recommendations from this meeting. What you can expect in the next 4 to 5 hours is that if you visit our web page for the meeting, you will have posted the draft conclusions and recommendations from this meeting. So we are going to collect, it will be not more than 2 pages. We will just put together some of the major points that have been discussed here, and in terms of the national practices and in terms of what has been acknowledged as relevant for the teams and the sessions for this meeting. So it will be, as I said, the maximum 2-pager. We just want to have something that you can take home with you at the conclusion of the meeting and then present that to your principals as one of the immediate outputs of the meeting itself. Of course, there will be a report of the meeting, but that is sometime in the making. We need several weeks. Also, the conclusions of this meeting will be incorporated into the report of the Secretary General of the United Nations to the UN Statistical Commission, and that will be presented to the Commission in March next year. So we have several requirements to meet with the conclusions and recommendations from this meeting. So 4 or 5 hours from now, check the web page. We will also send an email with a link, and then take some time. As I said, it's not going to be a lengthy document. Go through the draft report, and then tomorrow we will be reviewing the draft recommendations paragraph by paragraph until we are all on the same page and that we agree that this is something that this meeting would like to submit to the Commission in terms of assessing the impact and the way that the countries are coping in terms of census taking during the pandemic. So this is the plan for tomorrow. We will be starting at the same time, 8 o'clock New York time. We will be on from 7:30. Should you like to check the communications and the technical issues there. We will start at 8 o'clock, and then we hope to be done, of course, by 11 at the latest. Hopefully, it will not take that long, but for the purposes of planning your time and your schedule tomorrow, please take this into consideration. So are there any comments at this point of time? Any suggestions regarding the way that to proceed? I see no hands raised. Again, thank you all very much. With each day, we are learning more and more. We are getting a much better understanding on how the countries are adjusting, adapting, and interpreting the data that the census is collecting, and this is of I would say extremely useful and of great worth for not only us as census takers and working in national statistical offices, but primarily for the users of the data and the stakeholders, for them to understand the small area statistics that they are going to look at. And we all know that politics is all local, and those granular data are critical for assessing how the people actually live and what are the conditions. So they need to those data need to be explained at as much as possible and to take into account this pandemic that we are all trapped in for the time being. So again, thank you all very much. Thank you the presenters. Thank you the participants. We will again post the draft principles, conclusions, and recommendations, and we will then touch bases tomorrow morning, 8 o'clock New York time. Thank you all and have an excellent rest of the day or rest of the night, depend where you are. Thank you and goodbye.